But the fact is that in Los Angeles County, currently we have about 1 bed per 1,000 residents available. Post-Katrina, Louisiana had 2 beds per 1,000 residents available. So if that doesn't kind of give a sense of what's happening to our hospitals here, and with EMTALA, we are the safety net. We will continue to take care of these patients no matter what. So if people think they're just going to go away because you didn't pay for their care, it's not going to happen. We'll still pay for it in the end. So I think that's one of the things we need to get people to understand is that ultimately it's going to get paid for one way or the other. So again, we're better to do it on the preventive side than we are to wait until they wind up in our emergency room and complete another disaster and now spend weeks and weeks in our hospital getting care.
Assuming that everyone knows this issue has to be dealt with, where would you draw the line? What would you, how far would you push Congress to force them to address this? And to what extent are you willing to say, as Al, I think you were suggesting maybe, we understand this isn't going to be dealt with now, but let's deal with it in immigration reform. Is there anything you'd want in now that you think has to be addressed?
Just making sure that we hold the level of community health center support and new access point support that comes in. I mean, I think that's a real big piece on the FQHC 330 side.
We are mandated to not turn anyone away based on ability to pay. And personally, for healthcare professionals to become a part of immigration is, to me, personally abhorrent. That's not what I became a health professional to do. I became a health professional to take care of people. I don't care where they came from. And it needs to be out of the healthcare debate.
This is my my little spiel for the undocumented. You know, let's also be realistic. There's so many people that work and pump dollars into our economic systems. I mean, they're not asking for services for free. These are people that work, they pay taxes, and in many cases cannot claim those taxes because, you know, for obvious reasons. And so I hope that some of our leaders out there get a little backbone and also speak into that as well.
Just to also address your question, but we fully support, you know, the comments by Gloria and Mr. Ballesteros, of course. So where we draw the line, I mean, we recognize that any subsidy for undocumented immigrants is going to be very hard right now. But we support then the community aspect of this and the hospitals provision like they talked about. We definitely insist on covering those 5-year bar people under the system. And lastly, we're going to fight for prenatal care, even though that, you know, that's going to be very touchy, but we're still going to continue to fight on that. But the one major point that hasn't been addressed yet is that, you know, when President Obama made his speech and the representative from South Carolina, is it, that said, "You lie," that the Senator Baucus bill now even took out or made it explicit that even if you pay full price on the exchange, you know, if you're not here legally, you can't even pay that. And we consider that absurd because, I mean, and first of all, you need the more people in the pool, the better, that pay into the system. Because we already are paying for them to be treated at the hospitals and at the clinics and so forth. But thirdly, you know, that community does not use the emergency room as much as we used to think in the latest study. So they're actually not burdening the system that much. You have the paradox of the healthy immigrant. And yet, if they do have the resources, we should allow them to go ahead and pay full price, at least, at the very minimum.